The autumn rain pelted against the windows of Memorial General Hospital as Dr. Miguel Ramirez sat in his silver Mercedes in the parking garage, gripping the steering wheel with white knuckles. It was 11:47 a.m. on October 15, 2024, and he had just received another devastating phone call from his divorce attorney. Patricia, his wife of 15 years, was demanding additional alimony payments that would leave him financially crippled. $50,000 more by Friday, or she's going after your pension and the house in the Hamptons, his lawyer had said. The words echoed in his mind as he reached for the small silver flask hidden in his glove compartment, a habit that had started 6 months ago when the divorce papers were first served. Miguel Ramirez hadn't always been this man. 15 years earlier, he had graduated summa cum laude from Harvard Medical School, completed his surgical residency at Johns Hopkins, and was recruited by Memorial General as one of their most promising young surgeons. His colleagues respected him, his patients trusted him, and his reputation in New York's competitive medical community was spotless. But success had come with a price. The pressure to maintain his status as one of the city's top laparoscopic surgeons, combined with the grueling 80-hour workweeks, had slowly eroded his marriage. Patricia had grown tired of canceled dinners, missed family vacations, and a husband who was more devoted to his patients than to his own family. Their teenage daughter, Isabella, had started acting out, first with poor grades, then with shoplifting, and finally with a drug arrest that had made headlines in the local papers 3 months ago. The flask contained Macallan 18, expensive scotch that burned less going down and helped steady his increasingly shaky hands. 2 double shots later, he felt composed enough to face his afternoon surgery schedule. Maria Santos, a 34-year-old elementary school teacher and mother of 2, was scheduled for a routine laparoscopic cholecystectomy at 1:30 p.m. As Dr. Ramirez walked through the hospital corridors, he projected his usual confident demeanor. Nurses nodded respectfully as he passed, and residents sought his advice on complex cases. No one suspected that beneath his pristine white coat and professional smile, he was drowning in personal chaos and alcohol-fueled anxiety. Let me pause here for a moment. What you're about to hear is a story that exposes the dark reality behind the walls of one of America's most prestigious hospitals. It's a story about trust, deception, and the catastrophic consequences when medical professionals prioritize self-preservation over patient safety. If you're interested in true medical mysteries and want to see more content like this, please hit that subscribe button and ring the notification bell. Your support helps us continue investigating and sharing these important stories. The pre-operative briefing for Maria Santos's surgery took place at 1:15 p.m. Dr. Ramirez reviewed the patient's medical history with his surgical team. Rebecca Martinez, experienced surgical technician who had worked with him for 3 years, Dr. Jennifer Walsh, the anesthesiologist, and 2 surgical residents, Dr. Kevin Park and Dr. Lisa Chen. Maria Santos appeared nervous but optimistic as she was wheeled into operating room 7. She had been experiencing gallbladder attacks for months, and her primary care physician had finally referred her for surgery after conservative treatment failed. This was supposed to be a straightforward procedure, something Dr. Ramirez had performed hundreds of times before. "Good afternoon, Mrs. Santos," Dr. Ramirez said, his voice steady despite the alcohol still coursing through his system. "We're going to take excellent care of you today. This procedure typically takes about 45 minutes, and you should be able to go home tomorrow morning." Maria smiled weakly. "Doctor, I have to ask, I have 2 young children at home. My daughter Sophia is only 8, and she's been so worried about Mommy having surgery." "You've done this operation many times before, right?" "Hundreds of times," Dr. Ramirez assured her, the lie coming easily. While he had indeed performed many laparoscopic surgeries, his recent track record had become increasingly concerning. Over the past 4 months, he had experienced complications in cases that should have been routine, though none had resulted in patient death, until today. As the anesthesia took effect and Maria drifted into unconsciousness, Dr. Ramirez scrubbed in with methodical precision. The familiar ritual of surgical preparation usually calmed his nerves, but today his hands continued to tremble slightly. Rebecca Martinez, who had assisted in dozens of his previous surgeries, noticed the tremor but attributed it to fatigue. The surgery began at 1:42 p.m. The initial laparoscopic entry went smoothly, and Dr. Ramirez successfully identified the gallbladder and surrounding anatomy. For the first 20 minutes, everything proceeded according to plan. The gallbladder showed clear signs of chronic inflammation, but nothing that should have complicated the procedure. It was at 2:03 p.m. when disaster struck. As Dr. Ramirez attempted to dissect the gallbladder from the liver bed, his hand trembled at the worst possible moment. The electrocautery device, which should have made a precise cut through connective tissue, instead sliced directly through Maria's hepatic artery, the main blood vessel supplying the liver. "Shit," he muttered under his breath, immediately recognizing the catastrophic nature of his error. Rebecca Martinez, monitoring the laparoscopic screen, saw the sudden gush of blood that obscured the surgical field. "Dr. Ramirez, we have significant bleeding," she announced, her voice tense but professional. Dr. Ramirez's first instinct should have been to immediately call for backup, to summon the hospital's most experienced hepatobiliary surgeon, Dr. Richard Morrison, who was known for his ability to handle complex vascular repairs. Instead, pride and panic drove him to attempt the repair himself. "I can handle this," he said, his voice shakier than he intended. "Let's get some suction in there and improve visualization." What followed were the longest 18 minutes of Dr. Ramirez's career. As he struggled to control the bleeding and repair the severed artery, Maria's blood pressure began dropping dangerously. Dr. Walsh, the anesthesiologist, called out increasingly urgent vital signs: BP dropping to 90/50, heart rate climbing to 120. "She's losing a lot of blood." Rebecca Martinez watched in growing horror as Dr. Ramirez's attempts to repair the arterial damage only made the bleeding worse. His hands, normally steady and precise, fumbled with sutures and clips. The smell of alcohol on his breath, which she had noticed but dismissed earlier, now seemed overwhelmingly obvious. "Dr. Ramirez," she said quietly, "should we call Dr. Morrison?" "No," he snapped, sweat now visible on his forehead above his surgical mask. "I've got this under control." But he didn't have it under control. At 2:21 p.m., Maria Santos went into cardiac arrest. The next 45 minutes were a desperate attempt to save her life, involving multiple rounds of CPR, emergency blood transfusions, and every intervention in the hospital's cardiac arrest protocol. Dr. Morrison was eventually called, but by the time he arrived, it was too late. Maria Santos was pronounced dead at 3:07 p.m. Dr. Ramirez stood in the now quiet operating room, staring down at the body of a woman who had trusted him with her life. The magnitude of what had just happened, and what it would mean for his career, his already precarious financial situation, and his freedom, began to sink in. Rebecca Martinez was the first to break the silence. "Dr. Ramirez, what do we tell the family?" It was a question that would haunt him for the rest of his life. What do you tell two young children that their mother died because their surgeon was drunk? How do you explain to a grieving husband that his wife's death was entirely preventable? "Unexpected cardiac complications during surgery," he said finally, his voice barely above a whisper. Sometimes these things just happen, even in routine procedures. But even as he spoke the words, Dr. Ramirez knew that this was just the beginning. The death of a healthy 34-year-old during routine surgery would trigger an automatic review. There would be questions, investigations, and potentially lawsuits that he couldn't afford, literally or figuratively. That evening, as he sat alone in his empty apartment, Patricia had moved out 3 months earlier, Dr. Ramirez made a decision that would transform him from a negligent surgeon into a criminal. He would alter the autopsy results to hide his mistake, no matter what it took. The plan began to form in his alcohol-clouded mind. He had performed dozens of autopsies during his residency and maintained relationships throughout the pathology department. If he could get access to Maria's body before the official autopsy, he could alter the evidence of his surgical error and create documentation that would support a finding of natural cardiac death. It was a plan born of desperation and sustained by delusion, but to Dr. Miguel Ramirez, it seemed like his only option for survival. At 11:30 p.m. that same evening, Dr. Ramirez used his administrative access to enter Memorial General's pathology department. The basement level was deserted except for the night security guard, Frank Morrison, who had known Dr. Ramirez for years and thought nothing of seeing him working late. "Evening, Doc," Frank called out as Dr. Ramirez passed the security desk. "Burning the midnight oil again? You know how it is, Frank." "The work never stops," Dr. Ramirez replied, hoping his voice sounded steadier than he felt. The pathology suite was eerily quiet, illuminated only by emergency lighting and the soft hum of refrigeration units maintaining the morgue's temperature. Maria Santos's body lay on a stainless steel table, covered by a white sheet, waiting for the official autopsy scheduled for 9 a.m. the following morning. Dr. Ramirez had spent the evening researching everything he could about cardiac deaths during surgery, studying case reports and pathology findings that might support his cover story. He had also made a crucial discovery. Dr. Patricia Wong, the chief pathologist who would be performing Maria's autopsy, was scheduled to leave for a medical conference in Chicago the next afternoon. This meant the autopsy would likely be delegated to one of the junior pathologists, someone less experienced and more likely to accept his preliminary findings without question. As he pulled back the sheet and looked at Maria Santos's face, Dr. Ramirez felt a wave of nausea that had nothing to do with alcohol. This woman had trusted him. Her last conscious words had been asking about her children, seeking reassurance that she would be home to take care of them. "I'm sorry," he whispered, though no one could hear him. "I'm so sorry, Maria." But apologies wouldn't save his career or keep him out of prison. With shaking hands, he began the process of altering the evidence of his crime. The first step was to create surgical damage that would support his story of unexpected cardiac complications. Using a scalpel, he carefully made incisions that would suggest emergency cardiac intervention, the kind of desperate measures taken when a patient suddenly goes into cardiac arrest during surgery. These wounds would help explain the presence of surgical instruments near Maria's heart. Next, he turned his attention to the hepatic artery where his original error had occurred. The severed vessel still showed clear evidence of electrocautery damage, burns that could only have been caused by his surgical instrument. Using tissue samples from other areas of Maria's body, he carefully grafted material over the damaged area, creating what would appear to be natural vessel weakness rather than surgical trauma. The most challenging part of the deception was creating false tissue samples that would support his story. Dr. Ramirez knew that any competent pathologist would examine tissue samples under a microscope, looking for the cellular changes that would indicate the cause of death. He needed samples that would show cardiac tissue damage consistent with sudden cardiac arrest, not the arterial damage that had actually killed Maria. From his knowledge of the hospital's morgue inventory, Dr. Ramirez knew there was an elderly patient who had died the previous week from natural cardiac causes. The body was still in cold storage, awaiting family arrangements. He carefully extracted tissue samples from this patient's heart and arteries, samples that would show the natural degenerative changes consistent with cardiac death. Working with the precision of a surgeon but the desperation of a criminal, he replaced Maria's actual tissue samples with the falsified ones, labeling them with her information and sealing them in official pathology containers. The original tissue samples, the evidence that would have revealed his surgical error, were incinerated in the pathology department's medical waste disposal system. By 3:30 a.m., the physical alterations were complete. But Dr. Ramirez knew that the autopsy report itself would be equally important. Using his access to the hospital's computer system, he began drafting preliminary autopsy findings that would support his story. The report he created was a masterpiece of medical deception. Preliminary findings suggest acute myocardial infarction as the primary cause of death. Patient experienced sudden cardiac arrest at 2:03 p.m. during routine laparoscopic surgery. Despite immediate intervention, including emergency cardiac massage and multiple defibrillation attempts, patient could not be resuscitated. Tissue samples show evidence of acute coronary syndrome with complete occlusion of the left anterior descending artery. No evidence of surgical complications or physician error observed. Dr. Ramirez knew that this preliminary report would heavily influence the official autopsy findings. Most pathologists would review existing documentation before beginning their examination, and his false narrative would guide their interpretation of the evidence. As dawn broke over New York City, Dr. Ramirez finally left the hospital, exhausted but convinced that his cover-up would hold. He had altered the physical evidence, created false tissue samples, and documented findings that would absolve him of any wrongdoing. From a legal standpoint, he believed he was safe. But the psychological toll was just beginning. Meanwhile, just 40 minutes away in Queens, the Santos family was beginning their first full day without Maria. David Santos had been awake all night, holding his 2 young children as they cried for their mother. 8-year-old Sophia kept asking when Mommy would come home from the hospital, unable to understand that she never would. 5-year-old Miguel had withdrawn completely, refusing to eat or speak. Carmen Santos, Maria's mother, had arrived from Puerto Rico on the first available flight. As she held her granddaughter and tried to find words of comfort, she struggled with her own questions about what had happened. Maria had been healthy, athletic, and young. How does a routine surgery go so catastrophically wrong? The doctors said it was her heart, David explained to Carmen in Spanish, his voice hollow with grief. They said she had some kind of heart attack during the surgery. Dr. Ramirez told me that sometimes these things happen, even in healthy people. He said no one could have predicted it. Carmen Santos had raised 5 children and buried her husband after a long illness. She understood that death was a part of life, but this felt different. There was something in Dr. Ramirez's manner when he had spoken to the family, a nervousness, an inability to make direct eye contact, that had troubled her. "Did they say they would do an autopsy?" she asked. David nodded. Dr. Ramirez said it was routine in cases like this. He said it would help them understand exactly what happened and might prevent similar tragedies in other patients. What David didn't know was that the autopsy Dr. Ramirez had promised would be based on fabricated evidence, designed not to reveal the truth but to hide it forever. At 9:15 a.m., Dr. James Chen, one of Memorial General's junior pathologists, began the official autopsy of Maria Santos. Dr. Chen was competent and thorough, but he was also relatively inexperienced and heavily influenced by the preliminary findings that Dr. Ramirez had so carefully prepared. As Dr. Chen examined Maria's body, everything he found seemed to confirm the preliminary report. The tissue samples showed clear evidence of cardiac tissue damage, the physical wounds were consistent with emergency cardiac intervention, and there were no obvious signs of surgical error. "Looks like a textbook case of intraoperative myocardial infarction," Dr. Chen noted to his assistant. "Tragic, but not uncommon in patients with underlying cardiac risk factors." What Dr. Chen didn't know was that Maria Santos had no cardiac risk factors. Her medical history, which Dr. Ramirez had hoped no one would examine closely, showed a young woman with excellent cardiovascular health who ran marathons and had never had so much as an irregular heartbeat. But Dr. Chen, following the lead of Dr. Ramirez's preliminary report, focused on the tissue samples and physical evidence rather than the patient's medical history. The autopsy was completed by noon, and the official cause of death was listed as acute myocardial infarction during surgical procedure, natural causes. Dr. Ramirez received the final autopsy report at 2:30 p.m. As he read the official findings that cleared him of any wrongdoing, he felt a mixture of relief and self-loathing. He had successfully covered up his mistake, but at what cost to his soul? That evening, he attended the hospital's monthly surgical review meeting, where complex cases and patient deaths were discussed for educational purposes. When Maria Santos's case was presented, Dr. Ramirez listened as his colleagues discussed the tragic but unavoidable nature of her death. "Sometimes these things just happen," said Dr. Morrison, the senior surgeon who might have saved Maria's life if he had been called in time. "Young, healthy patients can have underlying cardiac conditions that don't manifest until they're under surgical stress." Dr. Ramirez nodded along with his colleagues, playing the role of the competent surgeon who had done everything right but lost a patient to unforeseeable circumstances. Inside, however, he was dying a little more with each word of sympathy and support from his unknowing colleagues. The cover-up was complete, but Dr. Miguel Ramirez was about to discover that some secrets are too big to stay buried forever. 3 weeks had passed since Maria Santos's death, and life at Memorial General had returned to its normal rhythm. Dr. Ramirez had resumed his full surgical schedule, though he found himself reaching for his flask more frequently and struggling to concentrate during procedures. The guilt was eating away at him like a cancer, but outwardly, he maintained the facade of a dedicated physician mourning the loss of a patient to unforeseeable circumstances. The first crack in his carefully constructed deception came from an unexpected source: Rebecca Martinez, the surgical technician who had been present during Maria's surgery. Rebecca had worked as a surgical tech for 8 years, assisting in thousands of operations. She prided herself on her professionalism and her ability to support surgeons through both routine procedures and emergency situations. But what she had witnessed in Operating Room 7 on October 15th haunted her dreams and consumed her waking thoughts. She had seen Dr. Ramirez's hands tremble. She had smelled alcohol on his breath. Most importantly, she had watched him make the critical error that killed Maria Santos, and she had witnessed his desperate, fumbling attempts to repair the damage while precious minutes ticked away. The official autopsy report stating that Maria had died from a heart attack made no sense to Rebecca. She had been monitoring the patient's vital signs throughout the surgery, and Maria's heart had been strong and steady until the moment Dr. Ramirez severed her hepatic artery. The cardiac arrest had been a consequence of massive blood loss, not a primary heart condition. For 3 weeks, Rebecca wrestled with her conscience. Coming forward would mean challenging one of the hospital's most respected surgeons and potentially destroying her own career. Memorial General was a tight-knit community, and whistleblowers were often ostracized and eventually forced out. She had a mortgage to pay and elderly parents who depended on her income. But every night, she thought about Sofia and Miguel Santos, 2 children who would grow up believing their mother died from an unpreventable medical condition rather than surgical negligence. They deserved to know the truth, and more importantly, other patients deserved to be protected from a surgeon whose drinking problem was putting lives at risk. The decision to come forward crystallized when Rebecca learned that Dr. Ramirez was scheduled to perform another laparoscopic surgery on a young mother, a 29-year-old woman with twin toddlers. The parallels to Maria Santos were too close for comfort. On November 8th, Rebecca requested a private meeting with Dr. Sarah Thompson, Memorial General's Director of Surgical Services. Dr. Thompson was known throughout the hospital as someone who prioritized patient safety above all else and had a reputation for listening to staff concerns, regardless of the political implications. Rebecca knocked on Dr. Thompson's office door at 3:30 p.m., her hands shaking with nervous energy. "Come in, Rebecca. What can I do for you?" Rebecca closed the door behind her and took a deep breath. "Dr. Thompson, I need to talk to you about the Maria Santos case. The patient who died 3 weeks ago during Dr. Ramirez's surgery." Dr. Thompson's expression grew serious. Maria Santos's death had been thoroughly reviewed by the hospital's Quality Assurance Committee, and the findings had supported the autopsy conclusion of death from natural cardiac causes during surgery. "What about the Santos case?" "I was the surgical tech in that operating room, Dr. Thompson. I saw everything that happened, and the official report is wrong. Maria Santos didn't die from a heart attack. She died because Dr. Ramirez made a surgical error while he was impaired." The words hung in the air like an accusation of murder. Dr. Thompson felt her stomach drop as she processed the implications of what Rebecca was telling her. "Rebecca, these are extremely serious allegations. Are you absolutely certain about what you're saying?" Rebecca's voice was steady despite her nervousness. "Dr. Ramirez had been drinking before the surgery. I could smell alcohol on his breath during the pre-op briefing, and his hands were visibly shaking when he scrubbed in. During the procedure, he severed Maria's hepatic artery with the electrocautery device. Instead of immediately calling for backup, He spent 18 minutes trying to repair the damage himself. Maria bled to death from that arterial injury, not from a heart attack. Dr. Thompson's mind raced as she considered the implications. If Rebecca's allegations were true, Dr. Ramirez had not only committed malpractice that resulted in a patient's death, but he had also somehow manipulated the autopsy findings to cover up his error. The legal and ethical ramifications were staggering. Rebecca, I need you to understand what you're saying. You're alleging that Dr. Ramirez was intoxicated during surgery and that he or someone else falsified the autopsy results. These accusations could destroy careers and result in criminal charges. I know, Rebecca replied. I've been losing sleep over this for weeks. But that woman has 2 young children who deserve to know the truth about what happened to their mother. And there are other patients whose lives are at risk if Dr. Ramirez continues operating while impaired. Dr. Thompson leaned back in her chair, processing the gravity of the situation. Rebecca, I need you to document everything you remember about that surgery in writing. Every detail, no matter how small. And I need you to understand that once we begin this investigation, there's no going back. Your career, Dr. Ramirez's career, and potentially the hospital's reputation will all be at stake. I understand, Rebecca said. But I can't live with staying silent any longer. As Rebecca left Dr. Thompson's office, neither woman knew that their conversation had been observed by Dr. Kevin Park, one of the surgical residents who had assisted in Maria's surgery. Dr. Park had been walking past Dr. Thompson's office when he heard Rebecca mention Dr. Ramirez's name and Maria Santos. Curious, he had lingered outside the door long enough to hear Rebecca's explosive allegations. Dr. Park faced his own ethical dilemma. As a resident, his career depended on the goodwill and recommendations of senior physicians like Dr. Ramirez. Coming forward to support Rebecca's allegations could end his surgical training and destroy his future in medicine. But staying silent made him complicit in covering up what might be criminal behavior. Meanwhile, Dr. Ramirez was beginning to notice subtle changes in how people interacted with him. Conversations seemed to stop when he entered rooms, and he felt eyes following him as he walked through the hospital corridors. His paranoia, fueled by increasing alcohol consumption and the constant stress of maintaining his deception, was beginning to affect his work. During a routine appendectomy the previous week, his hands had shaken so badly that he had been forced to ask Dr. Morrison to take over the procedure, claiming he was feeling unwell. The incident had raised eyebrows among the surgical staff, particularly because it was the 3rd time in recent months that Dr. Ramirez had needed assistance during routine procedures. That evening, alone in his apartment, Dr. Ramirez tried to convince himself that his cover-up was still secure. The autopsy report was official and filed with the state medical examiner's office. Maria Santos had been buried, and her family had accepted the explanation of death from natural causes. No one had questioned his story, and there was no reason to believe anyone ever would. But deep down, he knew that his crime had created ripples that were still spreading outward. Rebecca Martinez had been present during the surgery and had witnessed his error. The other surgical team members had seen his impaired state. Hospital security cameras had recorded his late-night visit to the pathology department. His computer access logs showed him reviewing Maria's case files at unusual hours. The evidence was there, waiting for someone with the motivation and authority to piece it together. Dr. Thompson spent that evening reviewing Maria Santos's medical records and the circumstances surrounding her death. What she found troubled her deeply. Maria had been a healthy young woman with no history of cardiac problems, yet she had allegedly died from a massive heart attack during routine surgery. The statistical probability of such an occurrence was extremely low. More troubling were the inconsistencies in the timeline. According to the surgical notes, Maria had gone into cardiac arrest at 2:03 p.m., but the emergency response team hadn't been called until 2:21 p.m. What had happened during those 18 minutes? And why hadn't Dr. Ramirez immediately called for backup when faced with a cardiac emergency? Dr. Thompson also noticed that Dr. Ramirez had personally handled many aspects of the case that would normally be delegated to residents or other staff members. He had been present during the autopsy discussion, had personally briefed the family on the cause of death, and had even volunteered to handle the paperwork related to Maria's case. Such hands-on involvement wasn't necessarily suspicious, but combined with Rebecca's allegations, it suggested a pattern of behavior designed to control information and minimize outside scrutiny. At 11:47 p.m., Dr. Thompson made the decision that would ultimately bring down Dr. Ramirez's house of lies. She contacted Dr. Patricia Wong, the chief pathologist, and requested an immediate review of all materials related to Maria Santos's autopsy. "Patricia, I need you to personally examine every piece of evidence from the Santos autopsy. Something doesn't add up, and I need to know if there's any possibility that the findings were compromised." Dr. Wong, who had been troubled by inconsistencies in Dr. Chen's autopsy report, agreed to conduct a thorough review. She had noticed that the tissue samples from Maria's case showed cellular changes that didn't quite match the documented cardiac history, but she had attributed the discrepancies to post-mortem changes. Now, with Dr. Thompson's explicit request for a complete review, Dr. Wong decided to apply advanced forensic pathology techniques that went far beyond the standard autopsy procedures. The investigation that would ultimately expose Dr. Ramirez's crimes was about to begin in earnest. Dr. Patricia Wong began her forensic review of Maria Santos's case at 6 a.m. on November 10, 2 days after Rebecca Martinez's meeting with Dr. Thompson. What she discovered in her examination would ultimately unravel one of the most sophisticated medical cover-ups in Memorial General's history. Working alone in the pathology lab, Dr. Wong applied advanced microscopic analysis techniques to the tissue samples that had been used to determine Maria's cause of death. She had performed thousands of autopsies during her 20-year career, and something about these samples had been nagging at her subconscious since the original examination. The first red flag came when she examined the cardiac tissue samples under high magnification. The cellular changes that indicated cardiac death were present, but they showed a pattern that was inconsistent with acute myocardial infarction during surgery. Instead, the tissue damage suggested a gradual process that had occurred over weeks or months, the kind of changes seen in elderly patients with chronic heart disease, not healthy 34-year-olds. "That's impossible," she muttered to herself as she adjusted the microscope settings. Maria Santos's medical records showed no history of heart disease, and her pre-operative EKG had been completely normal. Dr. Wong's suspicions deepened when she examined the arterial tissue samples. Under microscopic analysis, the samples showed signs of advanced atherosclerosis and vessel wall degeneration that would be expected in a patient decades older than Maria. The cellular structure was also inconsistent with the acute arterial trauma that should have been present if Maria had indeed died from sudden cardiac arrest. But the most damning evidence came when Dr. Wong decided to perform DNA analysis on the tissue samples. This was an unusual step in a routine autopsy, but Dr. Thompson's request for a thorough review had given her broad latitude to investigate any inconsistencies. The DNA results, which came back at 3:30 p.m. that same day, were shocking. The cardiac tissue samples that had been used to determine Maria Santos's cause of death had not come from Maria Santos at all. They had come from an elderly male patient whose genetic profile was completely different. Dr. Wong felt her hands tremble as she reviewed the DNA analysis results. In 30 years of medicine, she had never encountered a case of deliberate evidence tampering in an autopsy. The implications were staggering. Someone had intentionally replaced Maria's tissue samples with specimens from another patient in order to support a false cause of death. She immediately contacted Dr. Thompson with her findings. "Sarah, we have a major problem with the Santos case. Someone has tampered with the autopsy evidence. The tissue samples we used to determine cause of death came from a different patient entirely." Dr. Thompson felt the blood drain from her face. "Are you absolutely certain? DNA doesn't lie." Somebody replaced Maria Santos's tissue samples with specimens from an elderly male cardiac patient. This is evidence tampering on a criminal level. Within hours, Dr. Thompson had assembled a crisis management team that included the hospital's chief administrator, legal counsel, and the head of security. The implications of Dr. Wong's discovery went far beyond medical malpractice. They were looking at potential criminal charges for evidence tampering, fraud, and possibly even manslaughter. The investigation that followed was swift and thorough. Hospital security reviewed surveillance footage from the pathology department for the days surrounding Maria's death. What they found was Dr. Miguel Ramirez entering the morgue at 11:47 p.m. on October 15 and remaining there until 3:42 a.m. on October 16, hours before the official autopsy was scheduled to begin. Computer logs showed that Dr. Ramirez had accessed Maria's medical records, the hospital's morgue inventory system, and pathology database multiple times during the early morning hours of October 16. He had also used his administrative privileges to generate preliminary autopsy reports that were normally prepared only after the physical examination was complete. Most damning of all, tissue samples from Herman Mueller, an 78-year-old cardiac patient who had died the previous week, were missing from the morgue inventory. The timing and circumstances left no doubt that Dr. Ramirez had stolen tissue samples from Mr. Mueller's body and substituted them for Maria's actual specimens. Armed with this evidence, Dr. Thompson authorized a complete reinvestigation of Maria Santos's death. Dr. Wong performed a secondary autopsy using advanced forensic techniques, examining every aspect of Maria's body that hadn't been contaminated by Dr. Ramirez's tampering. What she found confirmed Rebecca Martinez's testimony in horrifying detail. Maria's hepatic artery showed clear evidence of electrocautery damage, burns that could only have been caused by a surgical instrument. The pattern of tissue destruction was consistent with an accidental severing of the artery during laparoscopic surgery, followed by inexpert attempts at repair that had only worsened the bleeding. The actual cause of Maria Santos's death was exsanguination. She had bled to death from the arterial injury caused by Dr. Ramirez's surgical error. The cardiac arrest that had been listed as the primary cause of death was actually a secondary effect of the massive blood loss. Dr. Wong's forensic analysis also revealed evidence of Dr. Ramirez's impaired state during the surgery. The pattern of his surgical errors showed the telltale signs of alcohol impairment, poor decision-making, delayed reactions, and hand tremors that had resulted in the fatal arterial injury. On November 15, exactly 1 month after Maria Santos's death, Dr. Thompson confronted Dr. Ramirez in his office. She was accompanied by hospital security and legal counsel, prepared for the possibility that he might attempt to flee or destroy additional evidence. They found Dr. Ramirez sitting at his desk, staring out the window at the city skyline below. The once distinguished surgeon looked haggard and defeated, his face gaunt from weeks of stress and alcohol abuse. An empty bottle of prescription anxiety medication sat on his desk next to a half-empty bottle of vodka that he had stopped trying to hide. "Miguel, we need to talk," Dr. Thompson said gently. Dr. Ramirez turned slowly, and Dr. Thompson was shocked by his appearance. Dark circles shadowed his eyes, his hands trembled uncontrollably, and his usually impeccable appearance was disheveled and unkempt. "You know why we're here," she continued. For a long moment, Dr. Ramirez said nothing. Then, slowly, he began to speak, his voice barely above a whisper. "Maria Santos wanted to be a teacher, just like her daughter Sophia dreams of being a doctor. She told me that during the pre-op interview, how Sophia wants to help people the way doctors helped Maria when she was sick as a child." His voice broke as he continued. "I robbed those children of their mother because I was too drunk and too proud to ask for help when I made that mistake. And then I compounded that sin by lying about it, by desecrating her body to hide my crime." The confession that followed was complete and devastating. Dr. Ramirez admitted to operating while intoxicated, to making the surgical error that killed Maria, and to the elaborate cover-up that included tissue sample substitution, falsified autopsy reports, and document tampering. He also revealed the personal and financial pressures that had driven him to drink and the desperation that had motivated his criminal actions. The legal consequences were swift and severe. Within hours of his confession, Dr. Ramirez's medical license was suspended pending a full investigation by the state medical board. The New York District Attorney's Office was notified, and criminal charges were filed within 48 hours. The charges were extensive and damning: second-degree manslaughter for Maria's death, tampering with physical evidence, fraud, and practicing medicine while intoxicated. Each charge carried significant prison time, and the combination meant Dr. Ramirez was facing up to 25 years in state prison. The hospital immediately contacted the Santos family through their attorney to inform them of the discovery. The meeting took place on November 18 in the offices of Morrison & Associates, the law firm that had been retained by David Santos after Maria's death to handle potential malpractice claims. David Santos, accompanied by his mother-in-law Carmen, listened in stunned silence as the hospital's legal representatives explained what had really happened to Maria. The room was thick with tension as the truth unfolded: that Maria's death had been entirely preventable, that Dr. Ramirez had been drunk during the surgery, and that he had spent weeks covering up his crime while the family grieved what they believed was a tragic but unavoidable medical event. "You're telling me that my wife died because this man was drunk?" David's voice was barely controlled, his hands clenching and unclenching as he processed the information. "And then he lied about it for a month while my children asked me why Mommy had to die?" Carmen Santos, who had suspected something wasn't right from the beginning, felt a mixture of vindication and rage. "I knew something was wrong. A mother knows when doctors aren't telling the truth. But I never imagined it was this bad." The family's attorney, Robert Morrison, explained the legal options available to them. "The hospital has already indicated they want to settle this case quickly and quietly. Given the egregious nature of Dr. Ramirez's actions and the hospital's failure to detect his impairment, we're looking at a settlement in the 8-figure range." But David Santos made it clear that money wasn't his primary concern. "I want this man to go to prison for what he did. And I want everyone to know what really happened to Maria so this never happens to another family." The criminal trial of Dr. Miguel Ramirez began on March 15, 2025, and became one of the most closely watched medical malpractice cases in New York history. The prosecution, led by Assistant District Attorney Jennifer Walsh, presented a methodical case that traced Dr. Ramirez's descent from respected surgeon to criminal. The evidence was overwhelming. Security footage showed Dr. Ramirez's unauthorized entry into the morgue. DNA analysis proved the tissue sample substitution. Computer logs documented his tampering with medical records. Most damaging of all, Rebecca Martinez's testimony provided a minute-by-minute account of how Dr. Ramirez's intoxication had led to Maria's death. Dr. Ramirez's defense attorney, David Chen, attempted to argue that his client's actions were the result of mental illness brought on by extreme personal stress. They presented evidence of Dr. Ramirez's messy divorce, his daughter's drug problems, and the financial pressures that had driven him to alcoholism. "My client is not a monster," Chen argued during opening statements. "He's a sick man who made terrible decisions while suffering from severe depression and alcohol addiction. His actions were inexcusable, but they were not premeditated murder." The prosecution countered that regardless of Dr. Ramirez's personal problems, he had made a conscious choice to operate while intoxicated and then an even more calculated choice to cover up his crime. "The defendant didn't just kill Maria Santos through negligence," ADA Walsh told the jury. "He then spent weeks desecrating her body and lying to her family to save his own career. These are not the actions of a man temporarily impaired by personal problems. They are the actions of a calculating criminal." The most emotional moment of the trial came when David Santos took the witness stand to describe the impact of his wife's death on their family. Fighting back tears, he told the jury about 8-year-old Sophia, who had stopped talking about her dreams of becoming a doctor because she was afraid that doctors couldn't really save people. "My daughter used to say she wanted to be just like the doctors who help people," David testified. "Now she wakes up screaming from nightmares about hospitals. Dr. Ramirez didn't just kill my wife. He killed my daughter's faith in the people she's supposed to trust with her life." The trial lasted 6 weeks, with expert witnesses testifying about everything from the effects of alcohol on surgical performance to the ethical obligations of medical professionals. The jury heard detailed testimony about how Dr. Ramirez's cover-up had violated not just legal standards but the fundamental trust that patients place in their physicians. On April 30, 2025, after deliberating for just 4 hours, the jury returned guilty verdicts on all charges. Dr. Miguel Ramirez was convicted of second-degree manslaughter, tampering with evidence, fraud, and practicing medicine while intoxicated. During the sentencing hearing on May 15, Dr. Ramirez was given the opportunity to address the court and the Santos family. His statement, while emotional, did little to mitigate the severity of his crimes. "I know that nothing I can say will bring Maria back or undo the pain I've caused her family," he said, his voice shaking with emotion. "I was supposed to heal people, to help them, to save their lives. Instead, I became the thing that destroys families and breaks trust. I will spend the rest of my life trying to understand how I became this person." Judge Patricia Rodriguez, who had presided over the trial, was unmoved by Dr. Ramirez's apology. "Dr. Ramirez, you violated the most sacred trust in our society, the trust between patient and physician. Your actions were not just criminal, they were a betrayal of everything the medical profession is supposed to represent." She sentenced him to 18 years in state prison, with the possibility of parole after 12 years. His medical license was permanently revoked, and he was ordered to pay $2.3 million in restitution to the Santos family. The impact of the case extended far beyond Dr. Ramirez himself. Memorial General Hospital faced a massive civil lawsuit that was ultimately settled for $12.7 million, one of the largest medical malpractice settlements in New York history. The hospital also implemented sweeping reforms designed to prevent similar tragedies, including random alcohol testing for surgical staff, mandatory reporting protocols for suspected impairment, and enhanced oversight of autopsy procedures. Dr. Patricia Wong, whose forensic investigation had exposed the cover-up, was promoted to chief medical examiner and became a national advocate for reforms in pathology practices. She testified before Congress about the need for stronger safeguards against evidence tampering in medical cases. Rebecca Martinez, who had risked her career to expose the truth, initially faced ostracism from some colleagues who viewed her as a troublemaker. However, she was ultimately recognized with the hospital's highest honor for integrity and patient advocacy. She became a spokesperson for healthcare workers who witness misconduct, encouraging others to speak up when patient safety is at risk. "I know some people think I should have minded my own business," Rebecca said in an interview with Medical Ethics Today. "But when I think about Sofia and Miguel Santos growing up without their mother, I know I did the right thing." Healthcare workers have an obligation to protect patients, even when it means challenging powerful people. 2 years after the conviction of Dr. Miguel Ramirez, the corridors of Memorial General Hospital had returned to their normal rhythm, but the scars from the scandal remained visible to those who knew where to look. The hospital's reputation had been severely damaged, leading to a decline in patient admissions and the departure of several prominent physicians who didn't want to be associated with the institution where such a massive cover-up had occurred. Dr. Ramirez himself was serving his sentence at Elmira Correctional Facility in upstate New York. Prison records showed that he had joined Alcoholics Anonymous and was working toward a bachelor's degree in counseling psychology through a correspondence program. He had also written extensively about his crimes, creating a detailed account that was being used by medical schools across the country to teach ethics and the dangers of substance abuse among healthcare professionals. His former colleagues were divided in their opinions of him. Some viewed him as a cautionary tale about the pressures of modern medicine and the need for better support systems for physicians struggling with personal problems. Others saw him as an irredeemable criminal who had betrayed the fundamental principles of medical practice. Dr. Sarah Thompson, who had initiated the investigation that brought Dr. Ramirez down, reflected often on the lessons of the case. "The most troubling aspect wasn't just the initial error," she noted in her memoir, published 3 years after the trial. "Surgeons make mistakes, we're human, and medicine is an imperfect science. What was truly evil was the calculated decision to cover up that mistake at the expense of a grieving family's right to know the truth." The Santos family had used part of their settlement money to establish the Maria Santos Foundation for Medical Transparency, an organization dedicated to advocating for patients' rights and supporting families affected by medical malpractice. David Santos had become a national spokesperson for medical reform, speaking at conferences and congressional hearings about the need for stronger oversight of healthcare professionals. Their children, Sophia and Miguel, were slowly healing from the trauma of their mother's death and the subsequent revelation of how she had really died. Sophia, now 11 years old, had resumed talking about her dreams of becoming a doctor, though she often said she wanted to be a good doctor who always tells the truth. The case had also led to significant changes in New York state law. The Maria Santos Act, passed by the state legislature in 2026, strengthened penalties for evidence tampering in medical cases and created new protections for healthcare workers who report suspected misconduct. Similar legislation was adopted in 12 other states, creating a national movement for medical transparency and accountability. Dr. Patricia Wong's forensic techniques had been adopted by medical examiners' offices across the country, and she had become a leading expert in detecting evidence tampering in autopsy cases. Her work had led to the discovery of cover-ups in at least 6 other cases nationwide, resulting in additional criminal prosecutions and civil settlements. Perhaps most importantly, the case had sparked a broader conversation about alcohol and substance abuse among medical professionals. Studies revealed that physicians had significantly higher rates of addiction than the general population, often driven by the stress and pressures of medical practice. New programs for early intervention and treatment were established at hospitals nationwide, aimed at identifying and helping impaired healthcare workers before they put patients at risk. The story of Dr. Miguel Ramirez serves as a stark reminder that the people we trust with our lives are fallible human beings who can be corrupted by personal problems, professional pressures, and moral failures. But it also demonstrates that truth has a way of emerging, often through the courage of individuals who refuse to stay silent in the face of injustice. Maria Santos never got to see her daughter Sophia grow up or watch her son Miguel take his first steps toward his own dreams. But her death, and the exposure of the truth surrounding it, may have saved countless other lives by forcing the medical profession to confront its own capacity for deception and self-protection. In the end, the price of Dr. Ramirez's deception was measured not just in years in prison or dollars in settlements, but in the fundamental trust that patients place in their physicians, trust that takes generations to build and can be destroyed in a single moment of moral failure. What did you think of this extensive investigation into medical corruption and cover-up? The trust we place in healthcare professionals is perhaps the most sacred trust in our society, and when that trust is violated, the consequences extend far beyond the immediate victims. Stories like this remind us why transparency and accountability in medicine are so crucial. If this in-depth analysis resonated with you, please give it a thumbs up and subscribe to see more detailed investigations into cases that expose the dark side of institutions we rely on. And let me know in the comments, what do you think should be the consequences when medical professionals prioritize self-preservation over patient safety? Your engagement and thoughtful discussions help us continue bringing these important stories to light and pushing for the systemic changes needed to prevent future tragedies.